Welcome to today's update on COVID-19 in New Brunswick. Bon après-midi tout le monde et bienvenue à cette
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick.
for the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, the Honorable Dorothy Shepherd, Minister of Health, the Honorable Blaine Higgs, Premier of New Brunswick.
Speaking on behalf of the province today are our province's Chief Medical Officer of Health, Dr. Jennifer Russell, Honorable Dorothy Shepherd, Minister of Health, and Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bonjour à toutes et à tous. Good afternoon.
Bon après-midi à toutes et à tous.
Nous permet de continuer à avancer et aujourd'hui, nous sommes venus vous en donner. Nous n'en avons pas encore fini avec la pandémie de COVID-19, mais nous sommes assez près de notre but pour définir les prochaines étapes afin d'y arriver. Santé publique a émis une série de recommandations au cabinet pour permettre au Nouveau-Brunswick d'atteindre la phase d'alerte verte de notre plan de rétablissement. Hope is a powerful force, and today is all about hope. We have not yet reached the end of our journey through COVID-19 in this pandemic, but we are now close enough that we can set out the route that will take us there. Public Health has recommended to Cabinet a series of steps that will lead New Brunswick to the green alert level of our provincial recovery plan. Premier Higgs and Minister Shepherd will provide the details of the plan shortly. Releasing this plan does not put us at the finish line of our pandemic journey, however. Le
COVID-19 is always amongst us and will be for a certain period of time, even after the green phase, but it is a message of hope. It's important that everybody knows at what point we are so close to the end line.
Giving everyone a purpose for continuing to be vigilant and focused. This is about giving everyone the strength to stay on course for a few more weeks. I understand how tired everyone is from the long journey, and we are all suffering from COVID fatigue. We do need something to revive us so that we can continue to do what we need to do and all the things that we need to get done. That thing is hope. By providing a map to our destination and the steps we will take to get there, we can all find a renewed sense of hope. With hope, we can find a new level of determination. Grâce à l'espoir.
Through hope, we'll be able to renew our commitment to follow public health guidance and advice with renewed vigor. We can keep our masks on, maintain physical distance, and wash our hands with the knowledge that our destination is in sight if we keep to our path.
To following public health guidance and advice with renewed vigor. We can keep on our masks. We can maintain physical distance and wash our hands with the knowledge that our destination is in sight if we keep to our path. And I have always known that we could get there if we work together, as we have been doing so very successfully. We must now redouble our efforts so that we all arrive safely at our destination. Aujourd'hui,
Today, Public Health has announced that 9 new cases of COVID-19 in New Brunswick. There are 3 new cases in Zone 1, that is the Moncton and southeastern New Brunswick. 2 of these contacts are existing cases, and 1 is directly related to travel. In Zone 3, which is Fredericton and the St. John River Valley, there are 5 new cases. 4 of these cases are contacts of existing cases, and 1 is a travel case. And that person is isolating outside of the province. There's also 1 new case in Zone 6, which is the Bathurst and Acadian Peninsula, and this case is under investigation. We now have 137 cases of COVID-19. This includes 11 New Brunswickers who were infected elsewhere and are isolating outside the province. There are 8 New Brunswickers now in hospital, including 3 individuals in intensive care. This includes 2 New Brunswickers hospitalized in another province.
of COVID-19 in the province. One in Zone 1, which is Moncton and the southeastern part of New Brunswick. There are 3 new cases today. Sorry, when I started that sentence, I thought it was saying 1 in Zone 1. There's 3 cases in Zone 1. 2 are contacts of existing cases, and 1 is directly related to travel. In Zone 3, which is the Fredericton and the St. John River Valley area, there are 5 new cases. 4 of these are contacts of existing cases, and 1 is a travel case currently isolating outside of the province. There is also 1 new case in Zone 6, which is in the Bathurst and the Acadian Peninsula area. This case is under investigation. We now have 137 cases of COVID-19 in the province, and this includes 11 New Brunswickers who were infected elsewhere and are isolating outside of the province. There are 8 New Brunswickers now in hospital, including 3 individuals in intensive care. This includes 2 New Brunswickers hospitalized in another province. These New Brunswickers need our support more so than ever. Please keep them in your thoughts and your prayers. We will have more cases as we progress through our vaccination program, and sadly, more sickness as we move along to our road to green. Our rates of hospitalization and deaths have been among the lowest in the country, which is a testament to our public health measures, our border restrictions, and the collaboration and hard work of all New Brunswickers. It is now time for the vaccines to do the heavy lifting. When at least 75% of New Brunswickers have been immunized with 2 vaccine doses, we will have the best protection against COVID-19, against serious outcomes, against hospitalization, ICU admissions, and death due to COVID-19, without using the same measures that we've had to put in place all throughout the pandemic that have brought us to this point and have protected our healthcare system. Our healthcare system will be able to manage the cases that occur beyond that point, which has always been our objective. We have come so far in this journey through the COVID-19 pandemic. The road ahead is now clear. Please let us stay strong and support one another so that no one falters on the last stage. Notre lutte.
Our fight against the COVID-19 pandemic has not been easy, but the road to follow is now well ahead of us. Let us stay strong and have solidarity up till the end. Thank you very much. Merci.
Good afternoon. Bonjour. It is exciting to be here today to talk about our path to green for New Brunswick. I'm sure some questioned whether this day would ever arrive, and as the pandemic has been a long, challenging road for all of us. But thanks to a lot of hard work, we are in a position to finally talk about what green will look like in our province. Before I start, I want to remind everyone that these dates are goals, and they are subject to change based on our vaccination rates and the number of hospitalizations. From the beginning, we have done everything we could to ensure that our healthcare system did not get overwhelmed. That will not change. The health and safety of New Brunswickers is our priority. The first goal that we have set under our path to green is June 7. If on that day, at least 75% of New Brunswickers 12 and over have received their first dose of COVID-19 vaccine, and we have a low number of COVID-related hospitalizations in our province, and all health zones are at yellow alert level, a number of changes will come into effect. These changes will include: there will be no isolation or testing required for those traveling within Atlantic Canada or Avignon or Temamuscuta regions in Quebec, with the exception of Nova Scotia. Travel registration, however, will still be required. Compassionate travel, such as travel related to end of life, funerals, and providing or receiving care, including child care not otherwise available, will be permitted for individuals from outside Newfoundland and Labrador, Prince Edward Island, Avignon, Temiscouata, with isolation and testing required on days 5 to 7 and released with a negative test. Compassionate travel will be permitted for those coming into and out of New Brunswick, but be sure to check with the province you are traveling to ensure that it is allowed under their plan. Cross-border commuters and truckers will no longer be subject to testing and isolation requirements. Other workers traveling from outside Newfoundland and Labrador, Prince Edward Island, Avignon, and Temiscouata, and those moving to New Brunswick and New Brunswickers who travel outside of the area must isolate with testing on days 5 to 7 and released with a negative test unless that person is under an existing work isolation plan. This includes rotational workers who are outside Newfoundland and Labrador, Prince Edward Island, Avignon, and Temiscouata. This is a reduction from the previous 14-day mandatory isolation. And please note, the whole family must isolate during this time unless the person who has traveled is isolating separately. This remains in place to reduce the spread of COVID-19. New Brunswickers will be allowed contact with all family and friends in yellow alert levels. Indoor informal gatherings will be limited to 20 people or fewer, while indoor formal gatherings can be up to 50% capacity with an operational plan. Outdoor informal gatherings are permitted with 2 meters of distancing between groups, and outdoor formal gatherings are permitted with maximum capacity with 2 meters of distancing between groups and operational plan. Organized sporting activities will be permitted. Games and competitions are restricted to players and teams based in Atlantic Canada, Avignon, and Temiscouata. Operational plans are required. Faith gatherings are permitted with an operational plan of up to 50% venue capacity, and however, the choir must be 4 meters away from the congregation. Please note that all other restrictions remain in place, including the need for travel registration and the use of masks. Our next goal date under our Path to Green is July 1st, Canada Day. If on that date, not only have 75% of New Brunswickers 12 and over received their first dose of COVID-19 vaccine, but at least 20% of New Brunswickers age 65 and over have received their second dose, and we have a low number of COVID-related hospitalizations in our province, and all health zones are at the yellow alert level, further changes will come into effect. And those changes are going to include travel registration will no longer be required for those in Atlantic Canada, Avignon, Temiscouata, Bubble, and the Atlantic Bubble will be open to include Nova Scotia. Canadian travelers, as well as travelers from Maine with at least 1 dose of COVID-19 vaccine, will be permitted into the province with no isolation required. Travel restrictions for these travelers will continue. Canadian travelers, as well as travelers from Maine who have not been vaccinated, will be permitted to enter the province, but will be required to isolate with testing on day 5 to 7 and released with a negative test. Please note that the addition of Maine into our plan is pending changes to the federal regulations. International travelers with no vaccine or only 1 dose will be required to isolate for 14 days with a day 10 test and a negative result. International travelers with 2 doses will not be required to isolate. This is also pending changes to federal regulations. We will also remove the designated isolation facility requirements. Businesses, including restaurants, gyms, and salons, will be permitted to operate at regular capacity if they maintain contact lists for clients. Masks must be worn when it is not possible to maintain a distance of 2 meters when patrons are not eating or drinking. Games and sporting competitions with players or teams based outside of Atlantic Canada will be permitted subject to travel requirements, and operational plans are still required. Starting July 1st, additional health and safety guidelines developed to respond to COVID-19 pandemic will be relaxed for early learning and childcare facilities. A full return to normal operations is anticipated by August the 1st. The Department of Education and Early Childhood Development will be communicating with operators in the coming weeks to provide more information and answer any questions they may have. All other restrictions remain in place until our next goal date under our Path to Green, which is August the 2nd, New Brunswick Day. If on that date, at least 75% of New Brunswickers 12 and older have received their second dose of COVID-19 vaccine, will be considered at the green level, and we will end the mandatory order. At this time, all restrictions will be lifted. This is a lot of information to take in, and all the details will be available online. But the bottom line is that green is coming, and it's closer than maybe we imagined. We are in this position thanks to a lot of hard work being done across our province to roll out vaccines quickly and efficiently. But that isn't the only reason. We are also here to thanks to those of you who have made your appointments, rolled up your sleeves, and gotten vaccinated as soon as you were eligible. Getting to this point has been a group effort, and one we should all be proud of. While better days are coming, and they are hopefully coming very soon, we must continue to follow the advice of public health and take the steps necessary to get there. Thank you for all that you've done to get us here. I ask that you continue to do your part to take us to the finish line. Get vaccinated, follow the directions of public health, and do what is needed to keep us in the yellow level until we can all move safely to green. Thank you. Merci.
Good afternoon. Bonjour. Today we can see a path forward beyond the COVID-19 pandemic. This is something we've all been looking forward to for a very long time. And I'm really excited to be here today to share it with all New Brunswickers. Comme le ministre Shepherd,
As Minister Shepherd had just mentioned, if the number of COVID-19 cases and hospitalizations remain low, and if the vaccination rates continue to increase as forecast, we'll be able to benefit of a greater liberty this summer.
7th, we expect to see travel restrictions loosened for workers, and discussions will resume with my Atlantic colleagues about reopening the Atlantic bubble. And we will be able to spend more time with family and friends. And if we stay on track, by Canada Day, the Atlantic bubble will fully be reopened. And travelers from the rest of Canada and Maine who have received at least one dose of the vaccine will be able to visit without isolating. I know this news comes as a huge relief for many, many New Brunswickers. Many of us have been separated from our loved ones in other parts of the country for more than 14 long months.
We have all known very difficult moments during this pandemic. Businesses had to make major changes in their activities, and in certain cases, they even had to close for long periods of time.
People who are required to travel for their jobs have needed to isolate away from their families. We have all been required to give up the simple daily activities that we've taken for granted, from hugging our loved ones to working in an office. We have all suffered loss. There are New Brunswickers who have become very sick as a result of contracting COVID-19. To date, 43 people have died in this province because of the virus. Everything we have given up over the last 14 months, all of our sacrifices, has been to prevent that number from rising. From the beginning, we have been a leader in our response to COVID-19. The pandemic has taken its toll on us, but when we look at other jurisdictions and see the pain and the suffering this virus has caused and continues to cause, I think we can agree that we are indeed blessed to live in New Brunswick. People living in other provinces and around the world look at us with envy when they see how much freedom we have been able to enjoy while still avoiding the full force and the damage of COVID-19 and all that it can create.
Other provinces who have opened their reopening plan over the past few days mentioned of allowing small groupings or to be able to eat in a restaurant. In New Brunswick, we are already at that point.
Increased availability of vaccines. We are taking strides toward the green level. By New Brunswick Day, August 2nd, when we anticipate 75% of New Brunswickers will be fully vaccinated, we expect to be able to fully move to the green level and remove the mandatory order. At that time, all restrictions will be lifted, and we will be able to freely travel in and out of our province. We will be able to resume the activities we enjoy and see the people we love without limitations. We are on the cusp of a very exciting moment. Just think of where we were 6-8 months ago and wondering when this all could end. The end is indeed in sight, but we must continue to be vigilant. We must continue to get our vaccines at the level that we have seen New Brunswickers coming forward to meet our targets. We have made it to this point collectively by following the rules of public health and the mandatory order. We will indeed arrive at the next phase of our recovery plan together as well. Nous avons tout.
We all have a role to play now to transform this vision into reality. We will have to continue to follow the regulations already in place, and this means to wear a mask in public areas and to respect the physical distancing by keeping away from others.
Remember that for now, we must only spend time with our steady 15 list of contacts. Nothing is changing today, only the hope and the reality of the changes commencing June 7th.
Stay at home when you are sick and get tested if you have any symptoms or if you were exposed to the virus. It is equally crucial that people make an appointment to receive the vaccination if it is not already done.
Everyone 12 and older is now eligible to be vaccinated through the pharmacy or Horizon or the Vitality Health Network Clinic. As we move forward on the path to the green level, we will continue to prioritize the health and safety of New Brunswickers. If we see rises in cases and hospitalizations, or we do not reach our vaccination goals, we will have to delay our target dates. We need to do this right. And to do it right, we need to continue to work together. We've done that throughout the pandemic in all sectors of society, on the political spectrum, within the civil service, and together we are moving forward at a record pace. We can't lose our momentum. For the last 14 months, we have indeed been running a marathon. We are all tired and anxious to reach the end. The finish line is indeed now in sight, and we just need to make it through this final sprint. Let's continue to show the world what New Brunswickers can accomplish when we work together and we have a unity of purpose. Once we reach this next milestone of successfully moving to the green level, it will only strengthen our resolve to be strong and move forward in so many other areas. We can all look forward to a bright future, free of restriction, and the beginning of reinventing New Brunswick. COVID will give us that springboard to look at New Brunswick in new and innovative ways. Together, we've made a difference in our province. Together, we will continue to make a difference in our province. together, we will reinvent New Brunswick like never before. Thank you. Merci.
Thank you, Premier. Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup à vous trois. We'll now
Thank you.
of the media. Each reporter will have one question and the quickest follow-up possible. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions.
We'll now proceed to questions from reporters. You have the right to ask a question in the language of your choice. Each reporter will have one question and a very quick follow-up. Make sure that you unmute your mics. Marie-Ève Brassard, Radio-Canada.
Oui.
Thank you, Bruce. My question would be for Minister Dorothy Shepherd. In fact, it was about the Atlantic bubble. I understood that June 7th, there are discussions with your colleagues, with the other premiers of the Atlantic provinces. We're going to continue. But I think the minister, I think you mentioned that June 27th, the Atlantic bubble could be reopened without Nova Scotia. So can you give a few details for the Atlantic bubble?
Yes, I will discuss that in relation to the discussion I've had with my colleagues in the other Atlantic provinces. And although we feel that at June 7th, we can look at how we can move more effectively through the Atlantic region, we know that that is going to be based on a risk assessment, and it's going to be based on developing a commonality between the other provinces. And so in the very recent discussion, just the other night, we talked about this possibility and happening in June, and it can vary. We feel we're ready to start those discussions June 7th and be in that position. But I understand that it certainly can be confusing with if other provinces have different rules and regulations. We were successful in the Atlantic bubble before because we actually, we had commonality of rules. So we'll work with the Atlantic region. We'll work with PEI Newfoundland, certainly initially, because of the situation they're in. And I'm confident that we'll be working with Nova Scotia, sometime in June as well, maybe toward the latter part of June, because certainly real progress is being made in their current situation. And in our discussion, we discussed optimistically how we'd all be part of the Atlantic bubble once again, certainly by the end of June.
Thank you.
Do you have a follow-up question? Yes?
There is no set date on June 27th as for the Atlantic bubble to be reopened.
Not an Atlantic bubble in its entirety, because every province will be looking at their situation. But I think what we're signaling here is that as of June 7th, we're in a position to resume those discussions in earnest and look at specific dates. And I think it's important that we try to align our dates. And I was speaking with Premier King just this morning in that regard. And I know currently they're looking at late in June, and we talked about the whole Atlantic region being ready in late in June, and that would include Nova Scotia. Whether we can do something sooner with PEI Newfoundland, certainly we're willing to have those discussions, and that was one element of our topics that we discussed the other night.
Thank you. Merci.
Thank you.
Adam Harris, Brunswick News.
A question for both the Premier and Dr. Russell. Some provinces have been moving up second doses of COVID-19 vaccines. Just doing some back of napkin math here on your new reopening plan, specifically phase 3, the August 2nd date, 75% of New Brunswickers having a second dose. Have you moved up the second doses for all New Brunswickers now, and by how much?
Hi, Adam. So basically, all of our dosing timings have been based on supply. So early on, when the supply was very, very low, we stretched out those first doses to 16 weeks so that we could get everybody vaccinated with that first dose, knowing that second doses would be most 16 weeks for those people that got vaccinated early with their first dose. But if you got vaccinated later with your first dose, you definitely would not have to wait 16 weeks because we would have a huge volume and a huge supply.
Mr. Harris, do you have a follow-up?
Yeah, a quick one. Bringing Maine into the fold in phase 2. Premier, is there an indication from the federal government that the international border rules will relax on July 1?
We actually have a national call tonight, and I know various provinces have been putting forward their reopening plan. So I anticipate that will indeed be a topic. And we're all looking at early July as potential changes. And in our case, we're looking at, our neighboring borders with, in this case, Maine, in the case of Quebec, or with Atlantic region. And trying to get families united again, because we know, like in the case with Maine, there's many families live and work on either side of the border. Tonight, the discussion, I think, will have more light shed on what the international rules are going to be and how that'll impact us as a province and what we think how we need to manage that respectively.
Thank you, Premier. Thank you, Mr. Hears. Savannah Odd, Telegraph Journal.
Hi there. I think this would be for the Premier. I believe you said the emergency order would be removed at the green alert phase goal, I guess, on August 2nd. But do you foresee having to bring that emergency order back again for any reason after that point? For example, if we see a new outbreak or there are more hospitalizations?
Well, I guess if you'd asked me 2 years ago, did I ever see invoking the emergency orders, Premier, I would have said, no, I actually don't. But given what we've gone through with COVID-19, at this stage, by August 2nd, if we've had 75% vaccination levels for 2 doses, we feel comfortable in removing the emergency order. And obviously, we'd be at that point, I'm sure Public Health would be able to give us a recommendation based on what we see as any particular health concerns that might be potentials at that point, or we wouldn't make the change. But right now, given all the knowledge we have and what's required to get there, we feel very comfortable that once we remove the emergency order, we would not need to bring it back.
Ms. Odd, do you have a follow-up?
Yes, thank you, Bruce. You mentioned these dates are partially contingent on low case count and low hospitalization. What exactly does that mean? And is there a specific number or threshold in mind as you're evaluating that?
I'm going to take that question. So the goal has always been, do we have access to ICU beds? Do we have a capability to manage with our hospital systems and our healthcare workers? Because we've had instances where some of our healthcare workers have been put into isolation, and put our hospitals at a disadvantage. And we know in Edmundston how our hospital was affected by the outbreak that happened there. So as long as those things are in place, and more importantly, I should say as importantly, our vaccinations. They are pivotal. And I just want to convey to everyone that we have right now ample supplies of Moderna and Pfizer, and they're both equally great. So please, if you haven't made your vaccination appointment, go online and do so. It's very easy.
I'll just add to what Minister Shepherd is saying about, again, our targets being obviously 75% of the population with 2 doses on board. And as quickly as we can get there, we have ample supply. The mRNA vaccines, Moderna and Pfizer, are very similar in terms of efficacy. They have the same safety profile as well. So there shouldn't be really any obstacles to or barriers to getting your vaccine at this point in time. And again, second doses will be offered very soon after, because we will have such a great supply.
Thank you. Marissa Duncan, CBC.
Thanks, Bruce. My question is for Minister Shepherd. Minister, I understand Public Health has started contacting people who have the mystery neurological illness that's under investigation right now to ask these people to consent to a questionnaire. Now, I know it's been a few months now since this illness was discovered, and some patients are wondering whether they'll even live long enough to know what's caused them to be sick. What would you say to those people where time is of the essence, who are asking why the province is not moving faster on this?
So I just spoke to this last week, and I will have a weekly briefing, which will be tomorrow, to update myself on the status of the clinic and the outreach to families. We are essentially starting from scratch. There has only been one disease eliminated from this factor, and that is Khrushchev-Jacobs disease. And so this is to be approached with not only a medical point of view, but a research point of view. And I know that this is agonizing for families looking for a diagnosis, because hopefully a diagnosis leads them to treatment. But this process cannot be hastened beyond what is being done right now. And I realize, again, it's difficult, but the researchers and the neurosurgeons and the neurologists who are involved are working diligently to outline those questionnaires, which I believe are complete, and that's why families are being contacted. We need to have them go through that process to answer those questions, to try to delineate that information, which may also lead to more questions. We have put in place an oversight committee to assist Dr. Marrero with this process and to ensure that we're covering all of our bases and all of the information that they give. We want to make sure that we've put expert eyes on it to do the very best. And we are working with national partners in order to help us try to delineate that information quickly and to get to the other side of this with hopefully a diagnosis. So I just implore them to be part of the process as soon as possible. And we know that this is a difficult time, and we want to get there as quickly as possible as well.
Ms. Donkin, do you have a quick follow-up?
I do, yes. Thanks, Bruce. Also for Minister Shepherd, and I know you mentioned some of the steps that are being taken there with the questionnaire, consulting with experts. Can you please detail what other work is going on in the province to figure this out in relation to the mystery disease? So, for example, we know you've partnered with a number of other government departments. Can you say which ones have people out in the field, for instance, gathering samples and working on this?
No, I would have to defer you until after tomorrow when I have another briefing, and we'll get specifics on that for you. I do know, as I've stated before, that this is, this is no holds bar, and this is all departments weighing in. If we think that they have something to contribute, we will be accessing every single team member, and this is a team effort to help us get to the other side of this.
Thank you both. Silas Brown, Global TV.
Hi there. Just wanted for the Premier. You had touched on this a little bit earlier, I think the first question, but just looking at PEI's reopening plan, setting the target for allowing other people from Atlantic Canada in without isolation requirements with June 27th. You seem to be targeting June 7th for PEI in Newfoundland. That's a big gap, and it seems like potentially the Atlantic provinces aren't really in alignment here. I'm wondering what the point of opening up to other places who may not be opening to us and not moving completely in lockstep as an Atlantic region is.
Yes, and I don't disagree with that comment at all. I think it is important that we align provincially, interprovincially, so that people aren't confused about what they do in different provinces. So I think the point that I want to emphasize here, and in my discussion with my colleagues and with Premier King just this morning, it's around the fact that yes, although we feel if we meet the vaccine thresholds that we're able to start that discussions on Atlantic bubble and to do so effective June 7th, we recognize that at this point PEI are focused on June 27th, and therefore our discussion was around, can we get a consistent date that we would feel good about? So that's when I say, yes, we feel we're ready on June 7th, but is there a point to open up if PEI is not ready or Newfoundland is not ready or Nova Scotia? Likely that would be confusing for some. So our goal will be to find a date that works. And in our discussions that we had as Atlantic premiers, we discussed mid-June, what's it look like? And I know Premier Rankin was hopeful in them, but he was focused probably more on the latter part of June. So we'll work together. I think the signal here today is that in New Brunswick, we're ready to commence a discussion on Atlantic bubble, commencing June 7th, and we believe that all factors remaining the same, we'll be ready. and the point of what the exact date will be that the other provinces will be ready will be determined.
Thank you, Premier. Mr. Brown, do you have a quick follow-up?
Yes, I do. This one's on a little bit of a different topic on the AstraZeneca doses. I believe a couple times over the last week, we've heard that there are about 3,500 doses that are going to expire at the end of the month. Are those going to be used? Are they going to be sent to other provinces? What's the situation with those specific doses?
Hi, Silas. Our plan is to use all those doses. As of right now, they're planned for second doses for anybody who's had a first dose of AstraZeneca who's 55 or older. And the clinics are occurring right now in terms of RHA clinics. And so that is happening already. That's underway. And we are actually using AstraZeneca as well with informed consent for people who can't go to an RHA clinic or to a pharmacy, so people who are homebound, et cetera. So that's the plan right now. We're hopeful that none of those will expire without having been put in somebody's arm first.
Thank you
So
both.
you're expecting that 3,500 doses will be used by Monday?
We are hopeful, yes.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Premier Higgs. Premier, are you worried that the large number of long-term care staffers who've been eligible for the vaccine for quite some time but who have chosen not to take it might be indicative of a broader hesitancy in younger groups towards vaccines and might prevent us from hitting the 75% target? And what happens if we don't hit that target?
Well, to answer the last question, if we don't hit that target, then our openings will be delayed. So if individuals decide that they're going to forego taking the vaccines and we miss our targets, our opening dates will all move accordingly. So that'll be concerning because it's the greater good that we're protecting here, and we all need to be part of that solution. In relation to those in the special care homes that we've identified and long-term care facilities, there's been a lot of progress made in the last 2 weeks. I think the number's gone from about a 50% where we were, 55%, up to in the order of 73 or 74% now that are vaccinated. We do have some homes, however, that have been identified that are in around 40 or 50 rather or less, and there's a renewed effort that is underway right now to ensure that they get vaccinated. The good news, in addition to that current level, is that all of the residents of those facilities have now received their second dose, and so that's comforting to know. The increased measures to encourage the vaccination levels will be daily testing for workers there. We're certainly working with the operators, owners, managers of those facilities, and we're encouraging them to actually have their employees be vaccinated. I think right now we're seeing that younger people are coming forward. In addition to the 50 plus, where we're meeting the threshold and beyond, we're seeing young people, since we opened up to 12, they're coming out in record numbers. So we don't see a hesitancy there, and at this point, we're very optimistic that we will reach our targeted vaccination levels.
Vicky, you snuck in too. Do you have a quick follow-up?
Yes. Will vaccine passports likely be a requirement for travel even within the Atlantic bubble?
I don't see that being a necessity within the Atlantic bubble. However, I am expecting that to be a major discussion tonight with the Prime Minister, and there will be probably a nationwide, obviously, focus on whether we need that. I think it'll likely be more related to international travel, but I'll learn more about that in the national perspective tonight.
Nick Moore, CTV.
Thank you, Bruce. My question is about the vaccine being expanded to ages 12 to 17. Has there been any discussion about including the school system beyond just sending information home to parents and guardians, but actually having clinics actually happening at the school?
So Minister Carty actually addressed all of those details yesterday in the press conference. And he actually walked through the steps in terms of the discussions and conversations that were had between public health and EECD around the logistics of operationalizing a rollout for students. And at the end of the discussions and the logistics and operational pieces, it was decided that the best way to get kids vaccinated was to have that opportunity in pharmacies and RHA clinics, and making sure that parents could actually access a vaccine for themselves at the same time. Transportation is an issue, and we have a good program in place right now.
Nick Moore, do you have a follow-up?
Yeah, just a quick one. Just for the concern about the number of long-term care workers who are getting vaccinated, has there been any kind of campaign or encouragement push to change?
We are seeing progress, and certainly social development has been working with the Nursing Home Association, and indeed even each individual nursing home and long-term care facility to ensure that that staff are comfortable and understanding what the vaccine is all about and how it works. I think that that's really important, but also that individuals have time to get their vaccine. And our latest past week showed us that we have certainly an incline in those that are vaccinated or have booked their appointments to get vaccinated. So we're optimistic that we're going to reach that 75% very soon.
Bobby Jean McKinnon, CBC.
Yes, thank you. Premier Higgs, you said last week you were seeking a legal opinion on mandatory vaccines for long-term care workers. Where does that stand?
So yes, we could proceed in case of the mandatory order and move in that direction. But I mean we did do a legislative bill here back last fall, and it was we moved away, and it was not agreed that mandatory vaccinations were in the cards. I think at this point we are confident that given the actual uptake that we've seen for vaccines, that we're going to reach our targeted levels, and it's not going to be a problem. If we don't, if herd immunity isn't achieved, then we'll have to discuss what the greater good is needed and go from there. But everything we're seeing so far, including the responses in long-term care facilities, is positive in that people are moving in a direction to be part of the overall success of New Brunswick in beating this pandemic.
Thank you, Premier. Ms. McKinnon, do you have a follow-up?
I'm sorry, so just a clarification on that. So the legal opinion you got was that you could, in fact, make vaccinations mandatory for long-term care workers?
Well, you could, but the best way to do that is actually under an employer standard, in which case the employer could say, a condition of employment at this facility is to be vaccinated, and that wouldn't be unlike other conditions of health and safety, especially in healthcare workers. The Quebec rules are different. Quebec have made vaccines mandatory in certain job requirements, and it's a very strict policy that they are able to put in place. But we believe that the best way to move forward here is what we're doing, and if additional testing is required, additional testing. And if we are finding facilities that really are not being vaccinated, then the employer has the right and the ability to insist that his facility workers are vaccinated. And in that case, we can work through that too, because if we want people to be vaccinated and we want to ensure people are safe in those facilities, which we do, there's other means that you look at how you manage that. And if people are tested every day as part of their job requirement, it's likely much easier to get vaccinated.
Ms. McKinnon, the quickest follow-up.
Yes. Again, for Premier Higgs, you also mulled the idea of posting vaccination rates of individual homes. Is the province going to do that? And if not, why not?
Well, we have considered that actually, and it was an option that we thought about and discussed in our COVID cabinet committee and in our cabinet. And so all the homes were identified, their levels of vaccinations were identified. And what was chosen to do at the end of the day was, let's focus on the ones that we already know. Let's deal with them directly. Let's call the homes, call the managers. Let's see if we can make a difference. And what we're pointing to here today is that we actually have made a difference. I mean, we've gone from a 50% compliance to about a 72, 73%. And the homes that are identified that are currently 50% or less we're going the next step. We're working with them directly, but mandatory testing could indeed be a reality commencing next week. So we won't let up on this. And as I said, having the workers vaccinated is certainly a requirement or a key part of the safety of the residents. But our residents today in these facilities have all been vaccinated with 2 doses. And that is a comforting statistic.
Thank you both. Simon Delac, l'Acadie Nouvelle.
Yes, question for the Premier. So if I understood correctly, starting on July 1st, it is the objective that travelers from the rest of Canada are going to be able to come to New Brunswick by following a shorter isolation period. So for what period and what are going to be the impacts for the tourism industry in the province?
Well, at this point, certainly, in terms of the tourism industry and our rollout of our plan, which I think is happening today or tomorrow, to introduce the rebate and have the activities here in our province be heightened and the awareness and the program to make that a reality. But the travel requirements, across the country. So we're looking as of July 1st that we would indeed be able to have people move from other parts of Canada, as well as from Maine. And again, that depends on some of the federal requirements. But in that situation, we're saying that they would be, have a single dose of vaccines at the least, and we wouldn't require any isolation in that sense.
Thank you, Premier.
You have a follow-up, Simon. So we'll be able to see tourists vaccinated come to New Brunswick. Could you repeat the question? Yes. So did you say that tourists who are vaccinated can come to New Brunswick this summer? Vaccinated tourists, can they come to New Brunswick this summer?
In other parts of Canada and Maine, initially commencing on July 1st, and that they would have at least 1 dose of vaccine.
Merci beaucoup.
Eder Ibrahim, CBC.
Thank you. This question is for Dr. Russell. Can you walk us through how the end of the pandemic does not mean total elimination of COVID-19? Can you just explain that a little bit? And also, can you tell us how will hospitals be more equipped or less likely to get overwhelmed when we go to green?
So for your first question, you're asking about walking you through what it means to continue to live with COVID while we're in green.
Yes, just a little bit if you could.
So we're basing the information and our guidance right now on information that we have today, knowing that there are still going to be surveillance issues around what we could learn in the future about emerging variants. And I didn't really want to focus on that today because we're really focused on hope. And we are going to, be vigilant and stay on our guard in terms of getting new information as things change and evolve. But in terms of what we know today, our advice around opening up and being able to live without the same kind of restrictions that we've had to for the last 14 months, that is the message around linking the vaccination rates of the population. 75% of the population with 2 doses equals being able to maintain our levels of hospitalization and case numbers without the same Herculean effort that we have up until now with respect to border measures, travel restrictions, and all the public health measures that people have adhered to so diligently throughout the pandemic. So the heavy lifter will be the vaccines and making sure that 75% of our population has those 2 doses for that protection. But again, things will continue to evolve and we will continue to learn as we go, and we will continue to take that information and base new decisions on that. With respect to hospitalizations, again, when you look at the number of cases per capita, cases per 100,000, hospitalizations per 100,000 of the population, ICU admissions per 100,000, deaths per 100,000, the Atlantic provinces, New Brunswick, have done extraordinarily well compared to the rest of the country. And so our hospital systems haven't been overwhelmed. We have been able to keep our numbers low, but it came at a price, and it came with a lot of hard work and sacrifice. Other provinces are having different types of opening up plans because of their approach. And because we had a different approach, we have a different type of opening up plan. Will we see case numbers drop? Will we see hospitalizations drop? Will we see ICU admissions drop? Will we see the number of deaths drop? We might not see the same kind of drop that other provinces will see per 100,000 because they've had such high caseloads, they've had such high numbers of hospitalizations, they've had such high numbers of ICU admissions and deaths compared to the Atlantic provinces. So I think what you'll just see is that we'll be able to maintain that status quo with respect to not overwhelming our healthcare system without the same kind of effort, and the vaccination program will help achieve.
Ibrahim, do you have a quick follow-up?
Yes, thank you, Dr. Russell. For Minister Shepherd or Premier Higgs, for the July 1st changes, how do you plan to verify that a traveler has been vaccinated?
Since we're still using the travel registration, I'm going to assume there might, it may be an honor system. But to be honest, we haven't quite certified that yet. So thank you for that question, and we'll try to get you an answer, a definitive answer on that really soon.
Thank you.
Thank you.
Maud Montembeau, Radio-Canada.
Yes, I'm sorry. It might be repeating what you've already said. Understand, Mr. Higgs, that the situation can still be degenerate. Can you be clear to say when the Atlantic bubble could open for the 4 provinces and when Quebec tourists, who represent an important aspect for tourism, can come to New Brunswick?
So what we're saying is that we feel that the Atlantic bubble, we will be in a position to have those discussions and start that as of June 7th. And I say have the discussions that we feel we're prepared to do that, but we need to work with our colleagues in other parts of the Atlantic region to determine their readiness. And we've already, had the message from PEI. And in the discussion I have with my colleagues over this past week, we also talked about, whether mid-June, the end of June would be a case where all of us could be together once again. And that obviously includes Avignon and Témiscouata. So that would be, the discussions that we'll have now in preparation for June 7th and through the month of June. As far as travelers, looking at Quebecers coming, let's say, to the Magdalen Islands, we spoke of that this week as well with Premier King. And we had a program set up last year, and we'd be looking at doing something similar in that regard, so that because we want people to be able to get to their properties, we want people to be able to get to their families, and I guess that the point is that we are looking at being able to open up to the rest of Canada July 1st, and obviously the vaccines play a role in that. And I guess I would just add to what Minister Shepherd said in relation to the determining the vaccine levels, and if you've been vaccinated. And while a lot of what we've done to date is certainly the success has been based on people's honor, and they're being truthful and open about what's transpired. So contact tracers were very able to be effective. Tonight's discussion with the Prime Minister and the other premiers will likely have a fair amount of input in relation to vaccine passports, and does that apply to Canadians? Does it apply internationally? So I would hope to have more insight into what my colleagues are thinking across the country. I know Dr. Tam is on that call tonight as well, and we'll have a little more insight to the minister's comments about just what that's going to look like nationally. Because I think although we wouldn't require it, I don't see, if we're all at the same vaccination levels through the Atlantic region and in our bubbles that we create, there may be an interest across the country for people moving in larger distances and coming to our region. So more information to follow. More information I'll likely gather tonight's call with the other premiers and the Prime Minister.
You have a very quick follow-up. Yes. So it's to say that people are going to come from Quebec or Maine as of July 1st. Will they need to have 1 or 2 doses? And did you have any indications from the federal that there could be openings of international borders with the United States to make sure that Maine people could come here?
Tonight, we'll get confirmation about international borders. I think they did extend, certainly India and such back a week or so ago. So we'll learn more about the international side of it. I think a lot will be connected tonight on our national opening and with the U.S. I think we'll see a lot of discussion there. Many provinces, and including ourselves, want to reconnect with the U.S. In a governor's meeting again about a week ago in the Atlantic Premiers, we talked about opening up with New England. We talked about the surplus vaccines that they have, and we've made a request to the federal government because the governors told us they have surplus vaccines that they would be more than willing to share. But that has to go through federal channels to make that happen. In relation to people moving, again, from Quebec and coming from any other province in the country, as according to what we've laid out today as of July 1st, if you're coming from domestically from other provinces with 1 dose of vaccine, then no isolation would be required for travelers. If you don't have a Canadian traveler without a vaccine, isolation would be required and testing in 5 and 7 days. And then, of course, if you don't have a vaccine, you're coming internationally or with 1 dose, then there is an isolation requirement. So opening up with the rest of Canada as of July 1st is very much a reality that gets us closer to what we're used to. And it is all dependent on reaching our vaccine targets so that we know that our citizens are protected. And that is the paramount to any of this being achieved. So I'm hopeful, given what our current trends are. We do seem to have the vaccine supplies and that's what our targets are based on and timelines. And people do appear to be coming forward. We just need to keep that pace up, and we will have summer in New Brunswick.
Thank you both. Tom Bateman,
Thank
Brunswick
you. Have
News.
a great day.
See you. Have a great day.
Hi there. Yeah, I'm here. My first question is about testing for people coming in and out of the province. I think Prince Edward Island today announced that they would require a rapid test for people even who have 1 dose of vaccine who will be traveling to the province. Are we doing the same, and why are we not?
Good afternoon, Tom. So I spoke earlier to the testing regime that we would have, and so continuing on in June 7th, with regards to some of those demographics, you're going to have a test between day 5 and 7, and can be released with a negative test, depending on where you're traveling from. The same thing will apply at the July 1st date. So depending on where you're coming from, whether it's in Canada or internationally, depending on your vaccine rate, there will still be a 5 to 7 day isolation period and a negative test to be released.
Bateman, do you have a follow-up? Oh, sorry. Dr.
Just to say that as the premiers of all 4 Atlantic provinces have conversations about measures that we're going to have in place, which we're going to be removing, and how the chief medical officers of health are also having those conversations, and the epidemiologists are also having conversations. And one of the things that is recognized in our unique situation, our proximity to PEI in Nova Scotia, is the interdependence of our healthcare systems, and PEI actually probably would be in the most vulnerable situation with respect to ongoing cases, hospitalizations, and any overflow would end up probably coming to Nova Scotia or PEI. So I think it's really great that we are all trying to look out for our own province's citizens, but we're also looking out for each other as well in our conversation with our Atlantic.
People, Bateman, a quick follow-up, please.
Yes, thank you. Why is herd immunity set at 75% in New Brunswick as opposed to 80% in other jurisdictions?
So Tom, that number has changed a few times. Prior to the variants, I remember many months ago, maybe 6 months ago, the conversation was around 60% at the national level was the target. And I think at that time here in New Brunswick, we were going to aim for 65% to go a little bit beyond that. But as the variants have emerged, the variants of concern and the worry about efficacy of vaccines against the variants and any new variants that would develop, that's why we're aiming a bit higher. You know, would we like to have 80%? Of course, if we could. But at this time, our target is 75%, knowing that we could overshoot that. I know we've already overshot in terms of, if you look at the graphic that we've put out, there's certain age groups that are already have overshot the 75% in different age groups. So if that continues, then great. We will have the supply to vaccinate more than 75%. And the higher that amount, the better.
Michel Corriveau, Radio-Canada.
Radio-Canada. Yes, good afternoon. It's a question for Dr. Russell. The subject was already dealt with in a bit, but I'd like to have at least 75% the objectives that we have for July 1st in terms, because I imagine there's going to be people from outside New Brunswick who are going to want to reserve hotel rooms or vacations in New Brunswick at that time. So at what point are we sure that we can get reach that objective on July 1st? It's a place to start to have something that we can have on our roads. And if it changes, it changes. I understand that there are people who want to travel and make their plans ahead of time at the present time. It's the beginning of the discussions and the beginning of our inroads, and percentages are going to be determined if yes or no we can succeed. I have no other information at the present time on the possibility that we're going to not succeed, and what means that people who have made plans to travel here, but that's it. That's all we can do at the present time. They have a follow-up. Yes, briefly. I'd also like to come back, find out how many in a green phase. How many what? It's not based on the number of cases. It's going to be based on the number of people who are hospitalized, those in intensive care, and if we have the capabilities at that time, and the percentage of people who have received their vaccines. Thank you.
Everyone, that concludes today's update. Merci beaucoup à tout le monde.
Thank you, everyone. This concludes today's update. Thank you very much.